Hi, everyone, and welcome to our Wound Care Micro Session series. I'm Sarah Holtman, Director of Clinical Education with Wound Care University. In these short sessions, about 10 minutes or less, we'll tackle one high impact topic at a time so you can take a practical pearl back to the bedside today. Today, we're talking about peptides in wound healing, what they are, why everyone's suddenly talking about them, and most importantly, where they actually fit in clinical practice. Because if you've had a patient ask about peptides or you've seen them all over LinkedIn or conferences, you're not alone. The interest is real, the evidence is still catching up. Peptides are short chains of amino acids that function as signaling molecules in the body. In wound healing, they influence key processes like cell migration, angiogenesis, collagen production, and inflammation. Think of them less as a direct treatment and more as messengers telling the body how to heal. You'll hear about a few peptides frequently. BPC 157 is associated with angiogenesis and fibroblast activity, but is mostly supported by animal studies. Thymosin beta 4 plays a role in cell migration and tissue remodeling, with some limited human data. LL37 is an antimicrobial peptide that may help reduce bioburden while supporting healing. Important point, these mechanisms make sense, but that does not equal proven clinical outcomes. Right now, most of the evidence supporting peptide use is preclinical, animal or lab based studies. Human trials are limited, often small, and not standardized. We also don't have clear dosing guidelines, delivery methods, or long term safety data. So, while promising, this is not yet a well established therapy. Before considering peptides, we have to ensure the fundamentals are optimized: perfusion, offloading, infection control, debridement, and moisture balance. No adjunctive therapy can overcome gaps in standard care. Patients may come in asking about peptides, so it's important to set realistic expectations and educate them on evidence versus anecdote. There are also safety and sourcing concerns with many peptides. Peptides may eventually find a role as adjunct therapies, particularly in wounds that fail to respond to standard treatment. They may also be useful in controlled clinical or research environments, but they are not appropriate as first line or standalone treatments at this stage. Chronic wounds often stall in the inflammatory phase, which is one of the biggest barriers we face. The idea behind peptides is that they may help re-signal or reset the wound environment to move forward in the healing cascade. That possibility is why they're getting so much attention right now. Some key takeaways. Peptides are promising, but the evidence is still evolving. They are not currently part of standard wound care practice. As clinicians, our responsibility is to stay informed while remaining grounded in evidence based care. The fundamentals will always matter most. If peptides become part of the future of wound care, it will be because strong clinical evidence supports their use, not because of hype. Until then, our focus remains on delivering high quality, evidence based care. Thank you for attending this wound care micro session. We value your commitment to patient care. We'll be back with another focused topic soon. See you next time.